AM 1240 and 95.3 FM, WJON. This is Health Matters, brought to you by Rejuv Medical. And my guest today is Dr. Joelbaumgartner from Rejuv Medical. Dr. B, thanks for joining me today.
Hey, you're so welcome. Great to be here.
So we're talking about inflammation today. How would you describe what inflammation is?
Yeah, good question. And it's almost like a loaded question in a way because, I don't know, when you think about inflammation, there's the good, there's the bad, and there's really the ugly with it. And unfortunately, most people think about the ugly, but when it comes to inflammation, there's actually some good to it as well. So we'll kind of give you a broader definition. And so inflammation is really a few things. It's something that the body needs. It's what fights infection. It's what helps to, fight injuries if we get injured. So inflammation is actually a good thing when it comes to fighting infection, healing an injury. The problem with inflammation, though, too, is it can get out of control, right? So an example of out of control inflammation would be like rheumatoid arthritis. It's a inflammatory arthropathy or inflammatory arthritis where the body is hyperinflamed and it's just attacking itself. So there's kind of a pendulum of inflammation. So you want good inflammation because if you had no inflammation, you have no healing, you'd have no repair, you couldn't fight infections because that's all part of the inflammatory process. But again, inflammation can get out of control, which is where we talk about, more inflammation with chronic disease or inflammation in the joints or inflammation with arthritis. So there's a whole gamut of things we can talk about when it comes to inflammation.
Well, since you brought up inflammation as it can be a good thing, that struck me because I think a lot of times with inflammation, you think, well, that's a bad thing. How can it be a good thing?
Right. Yeah. So inflammation is essential for life. It's the body's response to something that's an insult to it. So when we're talking about good inflammation, we're talking about the response that happens. Like, say I'm going for a walk and I slip on the ice since it's getting cold outside and I sprain my ankle. Well, what that causes is a sprain. And then sprain, what happens after that is the inflammatory cascade kicks in and it heals your sprain up. So what happens those first couple of days is it's throbby, it's achy, it's red, it's inflamed. It looks terrible, but that is inflammation. So one kind of good point with that, which is a good take home, is your tendency with an ankle sprain is to probably run to the cupboard and pop some anti-inflammatories. And you think, oh, anti-inflammatories, this is great. I'm going to suppress the inflammation and pain, and my ankle is going to feel better. So the thing there is, yes, anti-inflammatories make you feel better because they are good pain medications. They're analgesics. But the problem is all the research is now showing those that pop the ibuprofen after an injury or surgery or something that happens to the body have delayed healing and not full healing of that injury. So that's one sense where you actually want to let the inflammatory process play itself out so that ankle will heal itself. So that is an example of good inflammation that the body has created for a purpose, and that's to heal the body. In fact, it's the same theory with what the whole regenerative orthopedics realm is built off of. And that's what we do here a lot at Rejuv is we try to get the body to heal itself. So we use things like PRP and stem cell procedures to try to get the body to heal. And what those shots are doing is they're creating localized inflammation in the area of injury or degeneration or arthritis. And then the body thinks that's a small injury, goes back and heals it up using that inflammatory cascade I just described in the ankle. So in those situations, it's actually a very good thing.
So when it's not a good thing, the reason why you have like anti-inflammatories, how can you tell? How can you tell that it's not a good thing, that it's causing some other issues?
So inflammation, okay, then this is the bad and the ugly, right? So why is inflammation bad? So inflammation can be out of control. So a little bit of smoldering inflammation is like a fire that's kind of burnt down a little bit. You can roast your marshmallows and make a s'more. It's kind of smoldering. It's giving off some heat, and it's a good thing. And then there's the dude that goes and says, well, let's throw some gas on the fire, right? It's the same thing. It's the same heat source. But you throw gas on there, and it's way too much energy. It's way too much heat, and it causes damage to your s'more. You've got a black s'more, and you lost your eyebrows. So that's an example of inflammation gone awry. And you don't want too much. So things that can cause too much inflammation. So say in a normal person, right? So there's the pathologic inflammation, like we kind of alluded to, like rheumatoid arthritis, different inflammatory arthropathies where the body's kind of autoimmune in a way attacking itself. So that's not really the inflammation where I think we're talking about here. We're talking about, I'm a smoker. I like to eat pizza. I don't sleep really well. And then people just say, yeah, you're in a really inflammatory state. So it's kind of a broad-based blanket statement to say, but in the end of it all, it is kind of true because what's happening is that person is creating Too much inflammatory cells in the body, where the body kind of gets to a state of too much, which when there's too much of a good thing, just like a fire, right? Enough of it heats us up, but too much of it burns us and injures us. It's the same thing with that healing cascade. The right amount of inflammation heals, repairs, kind of keeps the check and balance. But if it gets overkill, the inflammatory process can then start doing destructive things to joints. It can start breaking down cartilage. It can start breaking down tendons. And hyperinflammation is very tender. It's painful. It hurts. So there's that pendulum. And in our goal, with, just being, smart people or being good doctors, is to try to use the inflammatory process when it's smart to do it, and to dampen it down when it's good to kind of bring the fire down a little bit. So that's part of the art of medicine, is using the inflammatory cascade in a smart way, such that you can augment the healing response, but that you don't, overdo things and injure a person.
My guest today is Dr. Joe Baumgartner from Rejuv Medical. Today we're talking about inflammation. This is Health Matters, and we're back in just a moment. AM 1240 and 95.3 FM, WJON. My guest today is Dr. Joe Baumgartner, Rejuv Medical. Today we're talking on Health Matters about inflammation. Doc, let's talk about what you were discussing towards the end of the last segment, where you're talking about trying to balance. How do you know when to allow for inflammation and when to try to dampen it down?
Well, in general, in most situations, like, again, this is referring to the person that does not have an inflammatory disorder, like rheumatoid arthritis or an autoimmune issue in the body, or the body's kind of hyperinflamed and attacking itself. Those types of patients usually will need a prescriptive medication to dampen down their immune system, so their immune system is not out of control. But for the everyday person, as far as when do you let the inflammatory process take its course and when do you not, I'd say more times than not, you're going to want to let the inflammatory process take its course. So again, you've got an injury, you've got arthritis, even like, you're weak and worried, you've got an achy shoulder. You're like, I'm going to pop an ibuprofen so I can go hunting this weekend, or I'm going to go ice fishing, so I'm going to pop some ibuprofen because my back hurts. So again, ibuprofen, Aleve, naproxen, they're all really good pain medications, so they cover pain. The dark side of it is, underneath it all, they're not doing healthy things to the joint that hurts. So say the low back, or to the the bad knee. There's also studies on people that take over-the-counter anti-inflammatory medications, and those that take those, they have a 2 times risk of progressing to a total joint replacement. And that's because the ibuprofen, the Aleve, naproxen is not healthy for cartilage. And in general, most of the times that we're taking ibuprofen and Aleve is because we have some kind of a soft tissue ailment. So again, the research both on acute injuries and chronic problems shows that ibuprofen and Aleve, naproxen actually may have detrimental or negative effects on the process inside the body. Again, not to say they don't stop pain, they're just not healthy for the joint. So that being said, people are like, well, then what can I do for my pain? Well, Tylenol, again, over the counter, does not have a negative effect on joints, tendons, or ligaments. Now, Tylenol, again, in too much is it can be harmful to the liver. So you don't want to be popping a ton of Tylenol a day. You can take up to 3,000 max a day before it's toxic to the liver. Oh, the one other thing too I want to say about the NSAIDs. Okay, so one, we said they don't really help the healing process. Number 2, the FDA now has issued kind of a black box warning on all NSAIDs, where they're prescriptive over the counter, including naproxen, Aleve, ibuprofen, is that they increase your risk no matter what dose you take of heart attack and stroke. So you could take one dose and it increases your risk, or you could take it all the time. So there's definitely a much higher risk of heart attack and stroke, not to mention hypertension, because of the side effect of those anti-inflammatories through the kidneys. And the third thing, too, we all know that it rots the gut. So increased risk of GI bleeds are also related to those anti-inflammatories.
Boy, it really...
So again, kind of a bleak picture, right? There are some things you can do that may not be too harmful that are considered anti-inflammatory.
Yeah, that's really where I wanted to go next, Dr. B, is that, those things cause some issues if you're popping them, like you're talking about. You use them on a regular basis. Are there some things that you can do that you could use on a regular basis that aren't harmful?
Yeah, I would, and I talk to my patients too about, the weighing out the benefits of the pain dampening versus the damage to the joint or the risk of, stroke, hypertension with the over-the-counter medications. Now, you can try some natural anti-inflammatories. The ones that are more natural, they actually have been studied. They don't have negative effect on tissue, but they do block some of that inflammatory cascade and dampen it down. And some of those would be like omega-3s. So you've heard of fats. There's good fats and bad fats. And some fats they're very inflammatory, like the omega-6s, your processed fats like your canola oils, and then also your some of those canolas and vegetable oils are very processed and they can be inflammatory. But the omega-3s, it's a very anti-inflammatory fat. So you can take fish oil, flaxseed oil, any of those oils or products, and it can actually dampen the inflammatory response, can help with pain a little bit, but it's good for the kind of inflammation that's out of control, maybe from an unhealthy lifestyle, you're eating bad, you're not sleeping good, you have some bad habits that are causing, quote, inflammation in the body. Fish oil is good to dampen that down. It also thins the blood a little bit, may decrease your risk slightly of maybe strokes and heart attacks. One big one now in orthopedics and in sports medicine is turmeric or curcumin. It's the substance in curry, if you ever like, Indian curry, that makes it kind of yellow. It's in mustard as well. So turmeric, curcumin is a good natural anti-inflammatory that's actually been studied and actually enhances the healing properties in injuries, but may damper down the pain as well. Those are kind of the natural ones. There's also some boswellia, which is almost like a salicylate. Well, salicylate would be in the aspirin category. Tart cherry extract is also in the aspirin or anti-inflammatory category. It actually has the same effect as an aspirin, tart cherry juice. So definitely you can do some things to dampen it down. You can just do some modalities as well. So you have a hurt shoulder, a little bit of ice or cryotherapy kind of dampens down that hyper-inflammatory response and shuts that down in your sore shoulder or low back as well. So one big thing just to think about is in general lifestyle. So if somebody has chronic headaches, chronic low back pain, they're chronically inflamed, they really have to take a look inside themselves and say, well, what's my lifestyle like? Am I sleeping 8 hours a day? Am I eating healthy? And, food is a big source of inflammatory issues.
Dr. Joel Baumgartner is my guest today. This is Health Matters in WJON. Today we're talking about inflammation. We're going to talk more about that coming up in just a moment here on WJON. AM 1240 and 95.3 FM, WJON. My guest today, Dr. Joe Vongert of Rejuv Medical. Today here on Health Matters, we're talking about inflammation and chronic pain. So let's touch on if somebody is taking things, whether it be anti-inflammatories, or they're using some of the other supplies that you mentioned that could be good and maybe not hurt you necessarily, but if the pain is still there, if you're constantly worried about the inflammation that you have in a joint, what are some things that you can do at Rejuv to help that person?
Yeah. So in general, most patients are not looking for cover-ups anymore. They're not looking for that steroid shot. And steroids, another quote in the anti-inflammatory category that we should probably touch on, just because it's so widely overused, I think. And, I see patients every day that have had 3 or 4 cortisone shots in their back or their joints. And the problem with cortisone, too, just goes down to data and research is cortisone, it was very popular back in the 80s, and it was good just to get you through the season. But what we're finding now is people that have cortisone shots to their spine, they have increased risk of spine fracture because it breaks things down and it atrophies things. Cortisone or prednisone into the joints does the opposite of healing. It actually, because it's such a potent anti-inflammatory effect, it actually stops the healing process and will promote degeneration and more tearing and breakdown of cartilage, ligaments, or tendons. So definitely want to avoid cortisone shots in the joint because of the negative side effects. So most patients that come to see me at Rejuv are, they don't want the cover-ups. They definitely don't want the cortisone. They're tired of popping, medications. They don't want the narcotics or anti-inflammatories. So then we just kind of get in that conversation. Well, what can you do that's healthy for the joint? So we alluded to some of the supplements like fish oil and turmeric. Great over-the-counter supplements, really easy to do. Another new one that's over-the-counter out there is just collagen. I mean, it's been around forever. It's what's in bone broth, right? It's just healthy collagen. Collagen's had some new studies out there showing it's actually really healthy for the joints. And so it might kind of decrease your pain a little bit. Often these over-the-counter remedies may not be enough, and that's why patients, come in to see us that specialize in more of a non-surgical approach to pain, arthritis, and degeneration. And here we might use some other things. Now, we can do a very low-dose anti-inflammatory injection into a joint to calm down the pain that does not use the high-dose steroids, and that actually can calm down the pain and make people a lot more functional, whether it's the back or the joints, But most patients, again, they're not looking for a cover-up. They want something more long-term. And that's where the data and the research is really trending more towards the regenerative procedures. And so that would include things like PRP, which is platelet-rich plasma. It's a injection of concentrated platelets from your own blood source, injected back into the joint where there's arthritis, the ligaments that are tearing, the meniscus, or the spine where things are breaking down and unstable. And those platelets, again, is part of your immune or inflammatory system. Those platelets start little, quote, fires that start up that smoldering healing process. And that, quote, inflammation then heals the body back up where it's degenerating. And now stem cells is really a similar type of a product. It's kind of the new kid on the block. And a stem cell is a procedure that comes from bone marrow. And again, it's your body's own bone marrow. And you take those cells, and those are really good for larger areas of arthritis, larger rotator cuff tears, areas where you need a little bit stronger healing modality. The stem cells are very helpful. So most patients nowadays are tired of the cover-up. They want the side effects of cortisone or the anti-inflammatories. And it's kind of a route that a lot of people are wanting because they're wanting to get back into life. They want to go for a run. They want to play with their grandkids. And it's a good option if you're trying to avoid some of those other things like surgery and the cover-up things.
What does the PRP do to the body? How does that make it so you don't have to pop those anti-inflammatories or to try to change some of your other lifestyle issues?
Yeah, I still recommend changing lifestyle because when you change those lifestyle issues, you will definitely have better healing with PRP. But what PRP does is, again, you're doing a blood draw, you take out the platelets, you concentrate it down, you take those concentrated platelets, and then with ultrasound guidance, I can see the joint, I can see the rotator cuff tear, I can see the meniscus, I can see the spine, and you deliver those platelets to the source of breakdown and injury. And then when I inject, 1 to 2 cc's per site, like for example, the knee, there's probably 20 or 30 different injection sites I'll do at one time, but each little aliquot of solution starts a little healing cascade. It mimics what happens when the body's injured. The body swells, it sends blood there, the blood heals the area. So when I do this, I'm just basically causing little areas of healing, micro injections throughout the whole area of degeneration. And the body then senses those platelets. The platelets start to cross-react. They start to bind to each other, and they start to create new tissue. So it's really just igniting the body's natural healing response to go back and heal those areas that are kind of breaking down over time and causing that pain and that degeneration.
How about when you've lost cartilage? Does PRP help with that?
Yeah, it's helpful for that too. Even we've done, we do a lot of bone-on-bone arthritic patients that are trying to avoid surgery. It's not necessarily going to build a new joint. We know it's not going to build a new joint. It will create, if there's some cartilage left, healthier cartilage in there. It will stop the negative influences of too much inflammation in the joint and remodulate that inflammatory response so it actually becomes more helpful in the joint. And then anytime somebody has a lot of degenerative in the joint, they also probably have issues in the soft tissue around there, the meniscus, the muscle attachments or the tendon attachments around there, the capsule, and all those things that stabilize. So it's not always just injecting the joint itself, but it's really a lot of those fine ligaments, tendon, meniscus, and other structures around the joint that actually stabilizes. So all those issues have to be treated and injected as well.
Does PRP work in all joints?
Yeah, there's some joints that are a little more stubborn. So like, for example, hips. Hips, sometimes if it's moderate to severe arthritis, we may upgrade a little bit quicker to a stem cell. But PRP works very well. As long as we can get the needle into that area and it's degenerating, it works very well for a lot of those areas. Again, we don't do a lot of those in patients that have hyperinflammatory arthritis like rheumatoid, where their body's already out of control of inflammation. Those situations, you do have to get that hyperinflammatory state under control before you do like a regenerative type route of treatment.
Dr. Joelbaumgartner, Rejuv Medical, is my guest today. We're talking about inflation on inflammation on Health Matters. We're back in just a moment. AM 1240 and 95.3 FM, WJON. My guest today, Dr. Joelbaumgartner, Rejuv Medical. Today we're talking about inflammation. All right, Dr. B, you mentioned stem cell in addition to PRP. What's the difference between the two of them?
Well, in theory, they're really similar. In theory, they're trying to create a healing response in the body that kind of goes back and repairs. They both would kind of fall into that category of, not a cover-up. They're not trying to make you not feel the pain like a cortisone shot or a drug. They're trying to actually take the degenerating tissue and heal it. So the difference between the two is the cell type. PRP comes from a blood draw, and that's a platelet. That's a component of the blood. Stem cells are also components of your blood, but they're very concentrated in bone marrow, and that's where they're actually created. So to get those concentrated stem cells to a high volume and a high number, it requires a bone marrow harvest, which actually sounds scary, but it goes very easily. And we take those cells out. We'll take up to 60 to 80 cc's of bone marrow. Again, we'll take that to the lab. We'll spin it down, and we'll separate out the cell line of the stem cell from all the different layers of the blood that come from the bone marrow. And then from that cell line, mixed with there's some fat layers in the bone marrow too that carry a lot of stem cell as well, is we will concentrate those down and then we'll inject that back in. Now, anytime we do a stem cell procedure, we actually always augment it with a little bit of PRP as well. Because when you add the platelets to the stem cells, it almost is like a catalyst. It's like a fertilizer that helps those stem cells to adhere, to grow, to repair better. So that combination works really well.
So do you think using both of those is generally more effective in your patients as opposed to just one?
Yeah, so if somebody has more severe issues, or if they want something that's going to maybe heal them faster than the PRP, the stem cell is the option to go. Like I said, anytime I do a stem cell procedure, I'm always combining that procedure with a PRP as well. Or we can just do PRP only, which is not quite as powerful, but also works very well for more, mild to moderate conditions.
Does that remove the inflammation from that particular problem joint permanently?
So kind of in a way, so it goes back to that definition of inflammation, because when you do those injections, whether it's PRP or stem cells, you are creating that inflammatory cascade that the body needs to repair itself. Remember, we talked about before too, if you dampen the inflammatory cascade too much with ibuprofen, Aleve, cortisone shots, you actually stop the healing process, which leads to more degeneration or wear of the body. So actually, after these types of procedures, we make sure that the patients are not taking any ibuprofen, Aleve, or naproxen afterwards, because it'll slow down their healing and their potential to regenerate after a procedure. So we actually want to get them off those anti-inflammatory medications. And so what it does, it actually creates a healing response and uses the body's natural inflammation to do that. So it's not necessarily in the end removing the inflammation, because in this case, the inflammation there is not a bad thing. It will modulate down things that are too hyper-inflammatory. It will bring down like certain cells that are out of control. So they're called macrophages. And in a hyperinflammatory state, they can be kind of munching away on things they're not supposed to be eating in those joints. But the stem cells do reprogram your macrophages, which is the main inflammatory cell, to start actually healing and not breaking down. So those stem cells do a lot of reprogramming in those cells that are already in the joint as well.
Dr. B, we have just a couple of minutes left. I wanted to bring up, for people that might be having some issues with their knee, their hip, ankle, back issues, do you have any suggestions on how people might be able to avoid those if they're doing exercise, if they're, I'm a basketball official. I know plenty of other colleagues that have had issues, and I think some have even come to see you to try to, help their issue long term. How can you, change the way you do things to try to minimize some of that inflammation that causes these issues?
Yeah. So again, remember, it's not inflammation causing the issues. It's actually degeneration. And they've done a lot of studies looking at tissue that's painful and tissue that's chronically breaking down. If the pain's been there for over 6 weeks, if I looked at that tissue under a microscope, it's called a histology study, there is no inflammatory cells in that tissue. So, and that's a bad thing. You want inflammatory cells in painful tissue because inflammatory cells are trying to heal it. What they find in the slides is it's actually just breaking down, degenerating, aging tissue with no healing cells in there. And so, again, one thing you don't want to do if you're a weekend warrior, you're a basketball ref, and you got to work 3 games this weekend, is pop ibuprofen to get through the weekend. Because it will help you get through the weekend, but you'll pay the price on the other end because the body will not heal itself during that time you're taking the ibuprofen. So one thing, weekend warriors need to do is they have to treat themselves like athletes. That means sleep, eat well, make sure you prep, you exercise, you have a good fitness routine. You've got good, what we call functional movement. That means you're flexible and you're strong around all those areas that you have to be performing around. So too many of us, as we age, we love to do the things we love to do, but we don't like to put the prep time in to get ready for it. But getting back into the gym, doing some yoga, stretching, preparing the tissue for the activities you need is super important for decreasing those micro injuries that occur over time and letting the body have its natural healing response when it is injured.
Is taking time off, is that beneficial, or is there, it sounds like, prepping the area, is that enough to be able to help with those problem areas?
Yeah, it's kind of you want to take a little time off, but you want to do smart time off. You want to kind of modulate down to whatever activity you're doing that's not painful, but you're still doing, some activity. So if you're like a runner and you're starting to break down, your ankles are hurting and everything's hurting, you may want to take some time off from running, but then you might want to do more yoga, Pilates, low intensity activities to give your body a couple weeks just to catch up and heal itself. During those 2 weeks, you're definitely going to avoid the anti-inflammatories, your like ibuprofen, Aleve. You might bump up your fish oil, your turmeric. You might sleep in a few more days. Make sure you're getting good hydration, getting enough protein, avoiding crappy carbs. All those things during that, quote, time off is going to help your body heal more. But during that time off, you still be working on your fitness and your flexibility and all those other good things that are going to help you when you get back into your sport or occupation or, thing that you just love to do on the weekends.
Dr. B, if people do have questions, concerns, issues, maybe they feel like PRP or stem cell makes sense for them, how do they start with that process?
Yeah, I'd say just come in, see us here at Rejuv Medical and get an office visit so we can kind of maybe update their x-rays, do a good physical exam, and get the right diagnosis. Once you know what's causing the pain, there's a lot of things we can do to help the body start that repair process, whether it's PRP or stem cells or some of the other things that we do. Yeah, just get in for an office visit.
Excellent. Joel, thank you. I appreciate it. We'll talk to you soon.
Sounds great. Talk to you soon.
That's Dr. Joel Baumgartner, Rejuv Medical. This is Health Matters on WJON. We return next week at this time.